It is our pleasure to present to you Ms. Stevens.
Thank you. I so appreciate the opportunity that you've given us today to bring this subject to you and give you some information that we think will actually transcend the veteran community. And I think you'll see how this is just relevant to all populations. Over 47,000 folks took their own lives in the United States. It's the 10th leading cause of death. Alcohol, drug abuse, murder, suicide surpasses all of those. About every 12 minutes, someone will take their own life. Now, we're talking about the United States in general right now, not the veteran population. And in the United States, you'll see that the yellow portion of the pie there, it's 50% is firearms. The next most common method, of course, is suffocation, and that includes hanging. Poisoning, which will include overdosing. The highest rate we know is for older white males. And females, women, have a higher rate of attempts of suicide. Men have a higher rate of dying by suicide. Firearms and suicide. As we saw in general, 50% involve firearms. In 2010, in the United States, about 20,000 people took their own lives with firearms compared to 11,000 who were killed by others. 90% of those who attempt suicide with a gun will die. It's that lethal. Whereas 90% of the folks who attempt suicide with another method will survive. Having guns or other firearms in the home is considered a primary risk factor for suicide. So in Florida, you'll see suicide with the 8th leading cause of death in 2017. The most recent statistics tell us that about 20 veterans are taking their own lives every day. 65% of the veterans who died by suicide were 50 years of age or older. 67% of the veterans took their lives using firearms, higher than the 50% of folks in the general American population. So the risk factors and warning signs. We're going to talk about how you might figure out that somebody might be at risk. So what leads to suicide? What causes suicide? It would be nice if your hand turned purple, if you were suicidal, and then we could tell, okay, bring him in, his hand's purple now, bring him in. It would be nice if it was that simple. It's unfortunately not any one thing. It's very often people who are overwhelmed by the stressors. It exceeds their coping capability. And they're suffering already from some kind of mental health condition, often untreated and undiagnosed. And if you think about it, we might think about, well, that's somebody else. I know somebody else over here who's bipolar, and I know somebody else over here who's got major depressive disorder. So if you've lost someone, if you've experienced a significant job loss, if you have had a divorce, lost your home, we all have had some sort of crisis in our lives. And during those times of crisis, we probably qualify for a mental health diagnosis. Right? We have probably all experienced some anxiety, maybe some mild depression. It's not unusual, and that's what we're talking about. We're not talking about just folks who go see a mental health therapist. We're talking about all of us, because we've all had something, right? Depression is the most common condition we associate with folks who take their lives. But we also need to think about things like anxiety. Anxiety can rise to the level of people having panic attacks who believe they're having a heart attack. It's that significant. You want that kind of feeling to stop, right? Substance abuse problems, huge issue with folks who take their lives, especially when unaddressed, undiagnosed. But we know that folks who get treatment, who stay in treatment, go on to lead fulfilling lives and may never be involved in thoughts of suicide. So suicide warning signs. one of the main things that you would notice, and these, because we're all kind of on the outside looking in, we're all observers on other folks, right? And you see changes in behavior. That's one of the main things to look out for is, and they're not positive changes. This is when you're noticing that somebody's just not doing well, and you notice that because of things you see, things you observe. It's the sharpest concern, new or changed behavior is related most often to a painful event, loss, or some kind of change. Most people who take their lives exhibit one or more warning signs, either through what they say or what they do. So some of the things to look for. Again, veterans, but non-veterans, right? Increase in drugs or alcohol use, right? We know that increase in drug use, then you're pushing yourself closer and closer to the possibility of an overdose. With alcohol, when you're using alcohol, it helps reduce some of those inhibitions, some of those obstacles that might keep you from taking your life, right? Because when you have better judgment when you're sober, right? When you are intoxicated, your impulse control might be out the window, your judgment might be out the window. The things that keep you safe sometimes are not there. Looking for ways to kill themselves, and this might be people looking for ideas about what would cause the least pain, things like that. They begin acting recklessly, withdrawing from activities, isolating from family and friends. And we'll see that a lot in our veteran population, isolation, but you may see that in other folks too, who suddenly are not coming to church, suddenly not coming to family dinners, suddenly not keeping appointments. They're suddenly, you're just not seeing them, and you think, my goodness, I haven't seen them in a while. Those are the folks that need to be checked on. Sleeping too much or sleeping too little. With our veterans, and we're likely not getting enough sleep, just usually not sleeping well at all. Visiting or calling people to say goodbye, and it's not going to be overtly goodbye, but they seem to be tying up loose ends. They seem to be saying things like, you've just meant so much to me in my life. You've always been there to help me. Those kinds of remarks. Giving away possessions or suddenly acting aggressively towards you like they've never done before. One of the things that folks often say when someone dies by suicide is, I didn't know that's what they were thinking about. They never said that they were going to take their lives. They never said they were going to kill themselves. And that's often true. Suicide is usually not a word most folks use when they're having these thoughts. But they'll say things like this. And these are the statements that we'll talk about, need to have the question asked. That they feel like that they're being a burden to others. And it may be, I'm such a burden to you, you have to come over here and take care of me or mow my lawn or whatever it is. They may talk about being a burden to their church family. They may talk about, and we hear this from veterans sometimes, who are often estranged from their family. They talk about being a burden in more global terms. If I wasn't here taking up your time, you could be taking care of another veteran. If I wasn't in here wasting all these resources, another veteran could be in here and have this hospital bed in my place. That individual is thinking about checking out. Feeling trapped, feeling that there is no escape from their pain, that there's no one to rescue them, that there's no other options for them, that just there's no one to talk to. There's no one that's going to help me through this. And that's why resources and information can be so important. And we'll talk about those. Experiencing unbearable pain. Physical pain is a big issue in our veteran population. And of course now we know the risk for overdosing on opioids. And we now know that after a while, opioids don't really work. They have a limited time of effectiveness, and then it becomes more of a placebo effect where people have kind of a security blanket reaction to losing them, right? If we finally tell a veteran, you've been on this for 10 years, this really isn't working for you anymore because you're still having breakthrough pain. We need to find another option for treating your pain. And people become very upset when you try to take their pain medication away from them. But there's also emotional pain. There's also financial pain. And I didn't really think about that until I came into suicide prevention. When you start losing your income, It's like a domino effect of the things that happen in your life. You lose your income, you lose your ability to provide for your family, you lose your home, you are homeless, you don't know where your next meal is coming from. That's painful. Having no reason to live, that purpose-driven life, a lot of folks don't feel they have that. A lot of folks feel like there's no reason to carry on. What am I doing here? I'm done. Right? Finding that purpose. One of the veterans I worked with had been very successful in his professional career, became suicidal, and the thing that helped bring him back was volunteering. And he became very active. He's super active as a volunteer now. Or talking about killing themselves. So those were the kind of things you're more likely to hear expressed by someone who's at risk for suicide than actually the idea of suicide. They may exhibit symptoms of depression, loss of interest in anything, in life, in doing anything. So you may see someone who's been very active who suddenly is not getting out of the chair. Rage, anger, irritability, snapping at you. Used to be a pleasant individual who now doesn't have the patience or inclination to interact with someone in a pleasant way. Or anxiety, very distressing, very uncomfortable feeling to be anxious. And you'll see that. Someone is suddenly very agitated, difficult sitting still, difficulty in maintaining a conversation with you. So the risk factors. There's a couple different kinds of risk factors. Some we just can't change in treatment. If primary risk factor is an elderly white male, I really can't do a whole lot about that in treatment. They're going to stay elderly white males. I can work all day long, and that's not going to change. What we do work on impacting in treatment are precipitating events, changes in someone's life that we can make a difference. And those are an increase in their substance use, mental health issues, and psychosocial stressors. And that's a long list of things like loss that people really have difficulty managing sometimes. But if we get them in treatment, we can make a significant impact. So other health issues include substance abuse disorders, serious or chronic health conditions, particularly a new diagnosis or changing condition. And what's interesting with that is it may not be what we think in general about a medical condition. So we may see somebody gets a new diagnosis and we think, okay, well, that's treatable. They can manage that well. You get on these new medications and you'll be fine. But to the individual, it matters their perception of this new diagnosis or the change in their medical conditions. And of course, chronic pain. Environmental factors include stressful life events that may include death, divorce, job loss. These are some of the psychosocial kind of stressors. Prolonged stress factors such as harassment, bullying, relationship problems, and unemployment. And, bullying and harassment, sometimes we just associate those with children. But that can be on the job. That can be, all of us have those experiences. Access to lethal means. Here we're coming to firearm again. And drugs. And those can be prescribed. Exposure to another person's suicide, graphic or sensationalized accounts of suicide can also be factors for some folks. If you come to work at the VA, you've probably been through SAFE training. Everybody gets it because we never know who may come into contact with a veteran in distress. So when you work at one of the VA clinics or the VA medical centers, you're all considered staff who can recognize a person in distress and get them to the help they need. And this can be the people who are sweeping the floor, this can be the people in the coffee shop, this can be our nurses all the way up to the director. It doesn't matter. Everybody has a responsibility to recognize a veteran in distress and get them to help. More recently, in the last couple of years, we've been moving SAFE training out into communities and offering this to non-veteran groups or groups who come in contact with veterans. And then that's then moved into the public health model for non-traditional kinds of groups. So this will be applicable to the veterans that you know, or to your own family and friends, or members of your congregation. So SAVE actually stands for stuff. The S is for the signs of suicidal thinking. A is asking the question, and that's going to be the tough part we're going to talk about. V is validating the veteran's experience or the experiences of the individual that you're concerned about, and encouraging treatment and expediting getting help. So signs of suicidal thinking, we've been talking about those already. But hopelessness, you hear someone talking about feeling that there's no way out, that there's no escape from what they're experiencing, no relief, no one to rescue them, no one to help them. But hopelessness. Sometimes helplessness is also expressed. Anxiety, agitation, sleeplessness, which may be related to mood swings. Feeling that there's no reason to live, that lack of purpose in a life. Rage or anger. Engaging in risky activities without thinking. Increasing drug or alcohol abuse, and withdrawing from family and friends, that isolation that we see so often. Thinking about hurting or killing themselves, looking for ways to die, talking about death, dying, or suicide, self-destructive or risk-taking behavior, especially when it involves alcohol, drugs, or weapons, and physical evidence of behavioral decompensation. That's a fancy way of saying they're not taking care of themselves anymore. They're not taking care of their home anymore. And you may see that quicker than, say, therapists or doctors may not see that as quickly as you would in the community. We may see that if they come to an appointment and they're suddenly appearing disheveled, or there's an odor that wasn't there before, things like that. We may notice that, but you're more likely to see this quicker than anyone else. Asking a question. This is the hard part. What we recommend in asking someone when you think that they may be at risk, when you think they may be in distress, is that you're just having a conversation with them, expressing your concern for them. That you're just talking to them about, how have you been doing? It's the best way to start. You may want to acknowledge some changes that you've noticed. Do you need me to come over and help you mow the grass? What can I do? I kind of see that maybe there's some things that I could help you with. Would that be okay? And just starting the conversation about, I've noticed this is my concern, how are you doing, can probably lead you into, do you have thoughts of taking your life? Do you ever think about suicide? I know through my experience in the military, a lot of friends have thought about suicide. It's very common among our veteran population to have those thoughts. So asking the question in whatever way is the most comfortable to you. There are no perfect words to use. You don't have to say, are you thinking of killing yourself? That may have too much of an edge to it. It may just be, are you thinking of taking your life? Do you think that you don't want to be here anymore? Are you thinking of leaving us in a permanent way? Whatever's comfortable for you. Whatever's going to come most naturally for you. Because it's a hard question. It really is a difficult question. So remember, when you're speaking with someone in crisis, that you want, this is always, they put this at the top because it's sometimes the hard one. It's like asking that question, remaining calm. Because the first time that someone sits across from you and tells you, yes, I have been planning to take my life, it kind of takes your breath away. So remaining calm, you have to kind of think purposely to yourself, to remember to breathe, take a breath, get your bearings, and then begin, right? Listen more than you speak. Because usually, these folks that are in this kind of predicament really want to get it off their chest. They just really need to find someone that they feel like is safe, that's not going to judge them, that is the person to talk to. So they're looking for that usually. But there's just so much stigma and so much fear that usually they're holding it in, right? Maintain eye contact. Let them know that you are there for them. Be confident. Don't argue. You're not there to try to talk them out of it. You're there to listen and to be supportive. Use open body language. The minute we start crossing our arms or putting a barrier between us and the individual, we're starting to shut them down. Limit questions again. Let them do the talking. Use supportive and encouraging comments. You want to keep that conversation going. And be honest that it's not a quick fix, that it's going to take some work and some time, but that there are services, resources, and treatment available. A lot of people struggle with their despair and their faith. And sometimes that's kind of what's pushing them. That they can't reconcile where they are with that lack of purpose. Well, if God loved me, I'd have a purpose and I wouldn't feel this way. Those kinds. Reassure them that you're there to help and support. Encouraging treatment and expedite getting help. So we're not asking you to assess folks. We're not asking you to be the people that provide the treatment. We're not asking you to try to differentiate. Are they just having thoughts? Are they making a plan? Don't keep their suicidal behavior a secret. And a lot of times they will, well, I'll tell you this, but it's confidential, right? You're not going to tell anybody. No, this is serious. If you were sitting across from me and told me you had chest pains, what would you want me to do? Right. This is the same thing to me. Somehow we think because it's our mental health that we ought to be able to control it or that it's shameful. But if it was chest pains, you wouldn't hesitate. You'd tell me, call an ambulance. Same thing. Your life may be at risk. I am not playing. I'm going to get you help. Don't leave them alone. You may have to make a phone call, make it in front of them. I mean, you don't want to hide what you're doing anyway. You want to be honest and straightforward with them, and you don't want to leave them alone. If you can get help to come assist you, great. But if you can't, you can't. Reassure the person you're there to help. Call or encourage a person or family to participate in getting help. If they can help you transport the person, great. If they can't, or you feel it's not safe, or sometimes you can't trust the family, the individual may have the power in the family and talk them out of taking them to the hospital. We've seen that happen. Oh, I don't really want to go. This is just that counselor talking at me or that preacher talking at me. I'm not going to the hospital. We can't afford it. Take me home. And it'll happen, right? So you have to trust that the person that's transporting them will get them where they need to go. It may be that you have to call a law enforcement officer or rescue. You just may have to do that because there may be no other option. I've had law enforcement officers go to a home, family was having a fuss and nobody needed to go to jail and nobody needed to go to the hospital, but they were veterans, and the deputy dialed the crisis line and handed the veteran the phone. It was so cool. But sometimes the veterans can't or won't call. So family calls, neighbors that are concerned about a veteran call. And what happens when you call 24 hours a day, 7 days a week, the phone is answered by VA staff at right now 3 call centers. There will be a 4th one added soon. These are social workers, nurses, psychologists, counselors, many of them veterans themselves, and that's all they do for a living. HBO did a documentary of Crisis Line Press 1. If you ever want to watch it, it's 40 minutes a day in the life of the Crisis Line staff. It's incredible. They won an Academy Award for that documentary. So talking to them, you're talking to the VA. And if the veteran wants a referral put through for assistance beyond that phone call, they will put the referral through, and this is usually for folks who are not suicidal, but they can be just having thoughts, and then we call them back and provide them the information, resources, and assistance, appointments. It's a good first step to get an appointment with the VA is calling the crisis line. The folks that call the crisis line who are actively suicidal, the crisis line takes care of rescue right then and there. They call law enforcement, they call the rescue ambulances out right then and there. The ones that get referred to us are the non-emergency kind of calls, and we take care of those. So by phone calling, the same number for the National Suicide Prevention Lifeline, press 1 for veteran and active duty military. Also a text feature to reach the crisis line. You can have a confidential chat on the computer with the crisis line, and now there's an app, of course, for the crisis line. So this gives you an idea. Since the Veteran and Military Crisis Line joined the National Suicide Prevention Lifeline in 2007, until I think it's last year, 2018, we had over 3.8 million phone calls to the Veteran Military Crisis Line. And of those, when you're talking about the number of folks who need law enforcement called on them, it's only been 112,000 people out of almost 4 million phone calls. So we're getting folks, that the good news is, early on in the process. Thus the name Crisis Line. We want folks to call as soon as they have an idea that something is going south. If you find out that maybe you're losing a job, if you find out that somebody close to you is dying, it's okay to call as soon as you think you may need help. Don't wait till the gun's loaded. Certainly you can call then. But we'd like folks to call us as soon as possible. Then we get those resources, those services, those appointments going, and they don't become more suicidal. So resources, we're going to give you some resources for not only veterans and their family members, but also for any people that you may be involved with. So one of the things that's, I think, really cool that the VA has come out with that would probably translate to working with anybody is a social media kit to help prevent suicides in the community. So it teaches you how to respond to folks who are making posts on Twitter or Facebook or those kinds of things, and you see them and read them, and it helps you figure out how would you respond to that? What would I say or do if I saw that in social media? Make the Connection is a really cool website for veterans, but also for family members, because it gives information about issues like transitioning from active duty to civilian life, PTSD, depression, substance use, and you can click on, whichever topic is of interest to you. But the really cool part to me is that there are YouTube videos from other veterans and their families about what worked for them. So it's not just one of us yakking at someone. It's actual veterans talking about, this is what worked for me. This might work for you. So I really like Make the Connection for that reason. We also have this kind of a card, a little placard that's out there on the table, Coaching into Care. And it's a phone number. Family members or friends can use it to assist veterans who are trying to become involved in the VA system. For those of you who have been involved in the VA system, you may know that sometimes it's difficult.
Yeah.
It can be frustrating.
Yes.
We find a lot of veterans experience some anger.
Yes.
And they just, if they have some... Not in your office.
So they say I'm not going anymore.
But if family and friends understand the process, are involved in helping the veteran through the process, the veteran doesn't have to keep all that bottled up. They can share with that veteran, well, let me fill out those forms for you. Or let me help you get this information requested. Let me make that phone call for you. So that's what Coaching into Care is about. It tells family and friends how to help that veteran get involved in the VA. So these are some phone numbers that are available 24 hours a day, 7 days a week. These are national numbers. Certainly, if you believe that someone is at risk of suicide, if they're telling you, I'm sitting here with the gun in my lap, and we hear that, you have to call 911. Mm-hmm. There's just no ifs, ands, or buts about that. Sometimes you just have to do that, right? It's not safe for you to transport someone with a gun. It's not safe for you to transport someone who's taken pills or maybe taking pills. You just have to call. You can ask for a crisis intervention team officer. These officers, and I know they're in Leon County because we participate in the training of those officers. They receive specialized training in working with folks who are having mental health crises. And they are here in Leon County. The National Suicide Hotline is also 24/7 support. This is for anybody, not just veterans. National Suicide Prevention Lifeline is the one we've been talking about the most. Certainly the main number is for anybody, and they'll say, thank you for calling the National Suicide Prevention Lifeline. For veterans and active duty military, please press 1. That's the difference. If you just stay on the line, don't press 1, it's for anybody. Vets for Warriors is a 24/7 support for veterans and their families, and it's a website. The Vet Center Combat Call Center. If you don't know about the Vet Center, you have one. You're fortunate that you have a Vet Center here in Tallahassee. And they specialize in treating combat veterans and their families, and veterans who experienced a military sexual trauma. You do not have to be referred there. The veteran can call directly, schedule an appointment, or walk in. And the vet centers will work during non-traditional hours. So if the family works, goes to school, they want to have maybe family counseling sessions, they will do that after 5 and on weekends. They do individual, group, family, and couples therapy. There's never a fee, there's never a copay, there's never a means test. The vet centers were started by Vietnam veterans when the VA told them, we've got nothing for you, right? And eventually Max Cleland brought the vet centers into the VA. And they've become part of our system now, but still maintain some distance. So for some combat veterans, it's a little easier place to go. It's quieter, it's more peaceful, it's more relaxed. Vet centers are a great resource. And this is their call line, 24/7. Combat veterans can call that number, or their families, for assistance and resources, and the people that answer that phone are combat veterans. Right? Wounded Warrior Project, they have 9 a.m. to 9 p.m. support and provide some services that are kind of non-traditional sometimes. And so it appeals to some veterans who just don't want to come in and do therapy, but might want to do more survival training or outdoor kinds of activities. Vets Prevail is very cool for veterans who think, I don't want to sit and have somebody shrink my head, or they've never been in therapy before and they're not sure what therapy might be like. So this is online cognitive behavioral therapy. They don't have that face-to-face, it's online. So somebody can try it out, see if they like therapy. They can use it to supplement their treatment and their therapy they're getting. And then Give an Hour, a really important resource we don't talk enough about. Give an Hour is available to any veteran, right? They use that website, there's no phone number. These are licensed mental health professionals who volunteer their time to serve veterans, to give them at least an hour a week, if needed, of therapy, no charge, outside the VA. So we've got veterans who can't, won't, or don't qualify for the VA, just don't want to come in, just don't want to deal with the VA. That's all right. But you can still get treatment through Give an Hour. And all they have to do is connect with the website, request the assignment of a therapist. There's never a fee for that. This is general website assistance for non-veterans or veterans, the Substance Abuse Referral and Treatment Hotline, and the National Sexual Assault Hotline. If you have other events, other situations that you need us, please call us. You have my contact information, and we're absolutely available to you. Thank you so much. Thank you so much.